So welcome everybody to another episode of the Slimming Surgeon podcast. I'm your host, Dr. Kandace Kichler. Today, I have a beautiful guest, Dr. Jacquiline Habashy Hakim, who is a double board certified dermatologist and Mohs surgeon who practices full-time in Beverly Hills, California. She is considered a world expert in cosmetic dermatology and is frequented by many celebrity clientele. I wish she could share exactly who and what they do. But last but not least, she is the CEO of Divina Dermatology and Cosmetic Center in Beverly Hills. So thank you so much, Jackie, for coming on.
Thank you for having me. It's an honor. I'm so excited.
Jackie and I met years ago. Well, you trained in Florida, or some of your training was in South Florida. So we met kind of through Instagram. We met at a conference, or we hung out then, and here we are virtually hanging out again.
Love it. I'm so excited. Hopefully I get to see you in person soon.
I know, right? One of us should host our own conference and just do it.
Let's do it. I'm in.
Okay. So today we have some really awesome information that we're going to share with everybody. We polled our Instagram audiences and got a list of kind of the most frequently asked questions. So I'm going to dive right in and we are going to put her brain to the test. Yeah. Okay. So Dr. Hakim, do you want me to call you Dr. Hakim, or what should we do here?
Perfect. Dr. Hakim is
okay.
You just get more names and that's fine.
Right. See, I didn't even give my husband that gift. He's just, sorry, Nick.
Totally fine. I didn't want to lose my maiden name because everyone knew me by Habashi. But I'm happy to take my hubby's name. We're evolving in names.
I love it. At least it goes well. It's a cute last name. Okay. So anyways. Exactly. All right. So tell us, what is the number one skincare item that you think everyone needs in their regimen besides an SPF?
Yeah, great question. Everyone this morning that I talked to about skincare, which your derm should always talk to you about skincare, but the best ingredient is a retinol. So retinol, tretinoin, a lot of that is interchangeable and you might hear it trending on Instagram or TikTok. Or retinol is just the more tolerable derivative that you can get over the counter. And so I always tell patients, that is an awesome place to start. Prescription strength tretinoins or retinoids is a little bit of a stronger molecule, but regardless, whatever you can tolerate is the best thing for you. I tell all my patients, out of the topical world, we know that retinols can induce collagen, and everything we're doing is to try to induce collagen, whether in office or procedures. So topically, we want to reverse some of the signs of sun damage and the signs of aging, and a retinol will do that for you.
So should people be using this every day and morning or night?
Perfect question to follow up. So retinol should be used at night, preferably, because most molecules get deactivated by the sunlight. So we want them to do what they're supposed to do. So at night use is the best. And it's one of those ingredients that can be slightly irritating to the skin. So I tell everyone to start slow. And I say do it about 2 times a week, give it a couple of days in between. Make sure your skin is tolerating it. If you're tolerating it and everything is great, keep increasing. So after 2 weeks, do it another night. So do it 3 times a week, all the way to every night. If you can tolerate every night, do it every night. But for those that are maybe more sensitive skin, skipping a couple of nights is great. Another tip I love is consider the sandwich technique. So we tell people at night, you want to always put skincare on a clean face. You start putting moisturizer on, then use a little retinol, and then do another layer of moisturizer. So it's kind of buffered in between two, which slows down the penetration, making it less irritating.
I love that. I used to do the retinol and then the moisturizer, but I never did the moisturizer first. So good tip.
If you can't tolerate it,
right.
It's like a little trick. But
because I always try to do the strongest stuff. So
I had a patient who I love literally give themselves a chemical peel. They lathered in a really strong prescription strength, and they looked great after the peel was over, but you don't have to push the limits, The best is to be consistent. So whatever that means for you and your skin type is great. What's your favorite retinol or tretinoin that you use?
I mean, I'm a big elastin girl, so I love elastin's retinols. They're so good. They're so well tolerated, but I feel like they work at the same time.
Yeah, Elastin is an amazing line. My favorite right now is the Sente. They have a BioComplete serum that's a retinol based, and I'm super sensitive skin, so it's one of my faves right now too. But I love
Love it.
elastins too. All for it. I have elastin here as well.
I know. And the ZO rep just came by our office and they have a new, it's like Booster A or something like that, which is considered prescription strength, I guess, because in certain states you can't just get this over the counter. I used it last night. So if I start peeling in a couple days, we'll know why.
Keep us posted.
I will. I will. Okay. So next question. We talked about our retinol. So during the day, what sunscreen should we be wearing?
So the key factors in sun protection and sunscreen, there's three main things that I always tell my patients. And this was studied in many studies, and the Board of Dermatology comes out with this information every year. So you want your SPF to say 30 or more. So the minimum is 30. And a lot of people think like the higher the number, the better. And that's slightly true. But once you're at 30, that protection is pretty much the same. There's slight variations of increase. So at least 30 on your SPF. You want it to say UVA and UVB coverage or broad spectrum. Those are usually interchangeable on the bottles or containers. And then the last item is we always recommend a mineral-based sunscreen. So what that means is that there's physical ingredients like zinc or titanium. And in the world of sunscreens, you have chemical and then you have physical. Chemicals actually get absorbed and then try to change the chemical reaction of sun to skin. So it tries to reduce that sun damage from chemical reactions versus physical just bounces off. It's like reflective. So we always like that preferably. And you get a little bit better coverage. When they're combined, that's also great. So as long as you're wearing sunscreen, it's a good thing. But those are the three factors we always recommend.
Okay, so in addition to UVA and UVB, should we be worried about screen exposure? Like I've seen some products advertise that they protect against blue light. Like, should I be worried about that damaging my skin?
Yeah, good question. So one of the mineral or physical ingredients is iron oxide, which is really amazing for what you just said, for blue screen, light emitting rays. So in front of computers, on our cell phones, television sets, even lights in buildings and offices. For patients that really suffer with what we call melasma or something called dyschromia, which is hyperpigmentation or brown spots from sun damage. There are studies that show that extra protection against some of those rays will be more protective because there are studies to show that those worsen those conditions. And so most physical blockers are great. And then iron oxide, which is combined with a lot of those mineral-based sunscreen, is that ingredient that really helps cover like the blue light or that emitted light that we try to minimize.
I love that. Okay, good to know because we're all on our screens
All
all the time. It's like the usage just keeps going up, but whatever, we're going to survive. Okay, so speaking about the sun damage, while lasers, we know that lasers can help remove sunspots and like make your overall appearance better, but are they actually reversing the skin or the sun damage? This is a really good question that I don't know the answer to, obviously.
Actually, there's a lot of science behind this, and a lot of studies have shown DNA repairs under the skin. So they actually take samples of the skin post-treatment and see what's going on. And they were able to see collagen induction, the reversal of DNA changes that the sun has induced. And we now know, and there's currently for the future, there are current studies going on because now they're treating skin cancers with lasers, and they're able to reverse some of those atypical skin cancers or atypical precancerous lesions through light and laser therapy. So hopefully one day that gets approved by insurance, but we do know that the science does prove it reversing actual sun damage, which is amazing.
So that is amazing. I mean, I'll laser my whole body right now if you let me. So what are your favorite lasers? Like, I mean, you can give me a spectrum. Like, what do you prefer for certain things or for certain age groups? Let me know like your top 3 or 4 maybe.
Yeah, so many variables, and the person's skin type is very important in selecting a laser. I always tell people too, like lasers are really the outcome and safety is by the person doing it, not just the name of the laser. So always tread carefully. For my sun damage patients, younger, want like a good boost is like a BBL, the broad base light, not the other kind of BBLs. Um,
We like both.
But in the light, it's not a true laser, it's a light therapy or like a photo facial. I think that's really good at sun damage. And we know that light therapy also helps reverse some of the sun DNA damage. So that's great. I love me a resurface. If people have some downtime to clean it up, I love doing an erbium resurface laser. So I do a lot of pro-fractional or micro laser peels to really just not only get the spots from the bottom with like a BBL, but I'll combine a micro laser peel and do a resurface for patients to really smooth out texture, get a lot of the superficial sunspots off. And then for patients that are more pigmented like myself, or what we call Fitzpatrick 3s, 4s, and 5s, I also love a good Pico, especially for hyperpigmentation. So good for facial rejuvenation, hyperpigmentation, really low downtime. So I'm
Okay.
a Pico girl.
I love it. I love it. This is going to be like probably one of my top listen to podcasts because you're basically giving everyone a consult.
Yeah.
But this is not medical advice. Don't hold us to it.
Yeah. Call your board certified dermatologist or surgeon for advice.
Exactly, exactly. So, and what are you, in the line of things that you recommend to patients, where does a chemical peel fall in this, skincare, lasers? Like, how often do you recommend these? What types are your favorite?
Yeah, so really it depends what the patient's coming in for. What I see so much of, and I just think I attract this patient population is kind of my skin type, but a lot of patients have pigmentation issues, melasma. I love a good peel for melasma. And so sometimes, we know melasma is triggered by heat. So lasers, even though they're non-heat based sometimes, can still trigger reactions. You have to be very careful. And that patient is perfect for a chemical peel. So I always love starting with a chemical peel for those patients. One of my favorites is the Cosmelon by brand, but there's different strengths and different variations of those. Really great for pigmentation. The other thing with patients is like, depending on downtime or, what their goals are, it's sometimes great to just do a light peel if they have a great event coming up and they just want like a glow. There's different peels, look glycolic peel and mandelic, that have really low downtime, but are great for just facial rejuvenation. If you have a wedding or a really great event coming up, we get a lot of red carpets. So you can do like baby peels or baby treatments to just glow the skin for those events.
I love that. So, I mean, I feel like I know the answer to this, but like, when should someone start doing peels or lasers? Because that is a hot topic and a big question that I get asked all the time. Like, well, when should I start doing this stuff?
Absolutely. I mean, honestly, that can be a little different, but I have patients that are more proactive and want to be preventative. And the science and certain studies say once you start seeing those aging signs, so we say the same thing for even injectables. Once you start seeing those like lines at rest, or if you're starting to see sunspots coming up, it might be a good idea to just start to get preventative and hopefully correct those a little bit earlier than later. Not to give it a hard age, but probably mid 20s is kind of the average age group that gets started in these things, especially for prevention. And I think that's totally fine. And you don't need to do a lot, even do a peel a year every 6 months just to rejuvenate, the skin. We all start losing collagen in our 20s. Like we all start aging in our 20s, which is really sad.
It's
So
really sad. It's terrible.
it's heartbreaking, but the good thing is we have items and things and lasers and chemical peels and injectables and a different array of options that help induce this collagen. So as you're losing it, you also want to just combat it, keep it balanced, and do something that's initiating some of that collagen production.
Absolutely. So, what is slugging? And is this actually helpful? I feel like this is such a TikTok trend.
It is a TikTok trend. It's not a bad thing. So what is slugging? It's basically doing ultra moisturization. So it's taking your moisturizer, applying it, but then applying a petroleum ointment based product, whether it's Vaseline, Aquaphor, there's so many brands out there now, but it's applying an ointment over your moisturizer. Ointments are not true moisturizers, but they're occlusive. So what it's doing is pushing that moisture in, and it's not allowing moisture to escape. So it's actually beneficial for patients that have really dry skin. Maybe it's that patient that overdid their retinol and they just like really want to replenish that moisture, or has, or just suffer during the winter season. A lot of patients get extra dry, and it's one way to do it. Do you have to do it? No, it's not necessary. It's not part of a routine that you should incorporate unless you need it. So not something you have to do all the time.
I feel like it would break me out.
Yeah, and it does with some people. So like hopefully that moisturizer is thick enough, and it's like a thick layer plus the petroleum, but petroleum alone on skin can be occlusive into your pores, and if you're acne prone, it can break you out. So slugging in general for acne prone patients is not the best.
Proceed with caution. Okay, so this is a good question. Is there anything that improves the crepey, fragile skin that comes with age? So let's start like with just in general, like face and body, and then maybe more specifically around the eyes, because I want to know.
Yeah, absolutely. So there's always many answers, and obviously it's patient specific. One of my favorite treatments for crepey skin, or quote unquote crepey skin, is actually a biostimulatory injectable. So there's two main ones on the market. One is Sculptra, one is Radiesse. Not sponsored by any brand. Those are just the two that are out there, but they've shown amazing resolution of crepey skin through collagen stimulation. And it's really cool because it's stimulating your own collagen. So it's not like other fillers where we're filling in for volume. We're kind of planting the seeds in area to just stimulate more collagen. And I love doing that in addition to radio frequency with microneedling. And I'll usually stack them together for optimal results. And so that is like whole body approach, kind of my go-to. But of course, every patient, you kind of select per patient. I would not do a biostimulatory around the eyes. It is not approved for that area. But I do love a good microneedling with radio frequency to try to induce some skin tightening, collagen. The under eye area is really complicated because some people need volume, some people don't need volume, some people need tightness, some people need to get rid of vasculature underneath for pigmentation. So there's a combination, just patient specific for that. But I do love a good microneedling with radio frequency for that area.
I love that. And have you been doing the microneedling with radio frequency on the body and seeing good results with that?
Absolutely. I think that
I just did my stomach like Kim K, and I'm telling you,
so it works. Yeah, that's actually probably out of the entire body. I would say the abdomen and inner thighs are the two top areas I do often with microneedling with radio frequency. And patients.
Okay, the inner thighs.
Play with
Nice.
it. Okay. I know.
The knees.
Yeah, I do a lot over the knee as well. It's probably third on the list, but the stomach for sure. And you're amazing and such a beautiful mother, and you bounce back so amazing after your baby. It's giving me so much.
A lot of work.
But sometimes the skin, once it gets stretched, it's just stretch. And so that is so common. And the number one thing most of my female patients postpartum and after their babies just come in to tighten that skin. And it really works. It's amazing.
It does. It does. I mean, I've only done one round and I see a difference. So if you do multiple sessions, like it will get even better.
We recommend anywhere from 3 to 5, but like you said, people will see a difference after one treatment, and that peaks at about 2 months. So you'll know pretty quickly that it's working or if that treatment works for you.
Exactly. Okay. So going into those non-HA fillers, so Radiesse, Sculptra, you like them for skin texture and tone. Like what are some other uses, and are you using them on the body?
Yeah. Yes and yes. So like I was briefly saying, so you can think of these as like seeds that create more collagen. We can use collagen everywhere. Like there's literally not a place in our body where you wouldn't benefit from the injecting of these. But the common areas we do a lot in the face, neck, chest, the back of the arms, especially over the elbows, similar to the knees, as well as in the buttocks. So those are probably the majority of the areas we inject. And it's just stimulating your own body. It's stimulating your own collagen. You can use it, and there's approaches to volumize. So when we use it in the face and we want a little bit more volume, there's ways to go about doing that. Or if you just want to improve the laxity and improve the collagen stimulation, you'll look the same, but have like a little lift and some improvements in skin quality. There's an approach to do it that way. And I think it's really great. I think regenerative medicine is on the rise, and these are a few of those regenerative products we have and we've had for a long time, but they're getting approved for more and more, and we definitely use it all over the body.
I know. I feel like, when I first started injecting and learning about all these things, like they were there, like
Yeah.
they've been there for, I don't know, 10 years or so, obviously longer. But that's just like how long that I've known about them. But all of a sudden there's been such a boom.
Yeah. And I think it's like it's getting, I guess, trendy per se, but it is very natural. So it's a great thing because it's your own body restoring its collagen. It's not something that's there to sit there. And there's a place for those as well. But I think people are jumping on the trend of natural, and I want to, just look like myself and maintain how I look. And I think they play a great role in it. They are constantly getting more and more approvals through the FDA. So it's opening up, a lot more use for a lot of people and injecting.
Exactly. I love that. Okay, let's kind of shift into more like while we were talking about collagen stimulation, do you recommend or do you know much about like oral collagen supplementation? Like, do you think that's something that's beneficial, or what are the studies showing?
A lot of people, and that was actually one of the questions I got on my IG, and I get this often. And so the studies are out, but they're not solid yet. There's nothing that's proven that this type of molecule is getting to that level of the skin to produce collagen. So I tell patients all the time, there's not one that's been proven. So I can't recommend it because there's not much science backing. But if it doesn't hurt you and you're enjoying it, just do your thing. Like if it's not hurtful and you feel better and you like to do it, I don't think it's a bad step in someone's routine. We just don't have the data to back a specific kind yet. And so there's like variations of collagen, hydrolyzed versus there's different particle sizes, and they're still studying which is the best one that actually makes a difference in the skin, because it can make differences elsewhere, but we just don't know what it's doing in our world aesthetically yet.
Exactly. I mean, I take it in my coffee, but like
Yeah,
I have zero side effects. It's not like I know I'm taking it. So I'm like, well, why not?
exactly. And if it can't hurt you and you enjoy it, whatever makes you feel good, I'm all for that.
Exactly. Okay. And then back to melasma. Let's just kind of dissect that a little bit for the listeners because, you have people who just have like everyday sun damage, dark spots, and then you have melasma. Like, what's the difference? How should we be treating that differently? Like, what's going to work for one and not the other?
Absolutely. It's a great question. And sometimes you really need to be, examined, but there's some features you can look for. So, melasma classically is bilateral, and that means it's present on both sides. So sometimes sunspots are only on your driving side, and sunspots are usually well edged. So they're not super jagged, or we call them like moth-eaten edges in melasma, where it's not a perfect circle. It's kind of just scattered edges and pigmentation versus a sunspot that's pretty well defined, most likely. Those are not like absolute truths, but those are more common ways of separating. Melasma has multiple layers of pigmentation, so you can have multiple, you can have one. And then the classic areas are usually along the cheeks, over the lip, and on the forehead for most people. You don't need to have it in all those areas to have it, but that's the classic distribution. Sunspots are usually maybe one-sided or just scattered around. So those are another differentiation way of deciding what someone has. And when it comes down to treating it, the thing with melasma is that it's chronic. And in medicine, that means for all the listeners that it lasts forever, which is not so fun. But we can get it to a point where it's managed. And that's the goal with treatment, is to get it cleared and manage it. So there's no like saving grace or magic wand with melasma where we can just get rid of it and then it's cleared forever. There's multiple factors that cause flaring, including stuff we can't control, like your hormones or your metabolism. Things we can control is our exposure to sunlight, or exposure to heat, which is it's not interchangeable. So heat is a full different thing, being in a hot room and a sauna, hot yoga, which a lot of my patients love, but it definitely flares their melasma. Eating, even eating spicy foods or hot drinks and that steam is like in your face, it's going to trigger that. So we have control over certain features, but not others. So it's one of those things where, as good as we are, you may always have a flare up. And so patients with melasma are on a strict skincare routine in my clinic for their whole year. And we insert where needed for like chemical peels, sometimes lasers and treatments to kind of keep it at bay. Whereas sunspots, most of them are more superficial. Doing lasers and treatments and chemical peels can get rid of them for good. But of course, sunspots can always recur, not the ones we probably take off, but you can always get new ones from a lifetime exposure to the sun. So just different in the treatment regimen there too.
No, I love that though. That's really informative because people, come in, like we have lasers and we have some skincare in our office. And if they have melasma, they get so frustrated because they're like, well, it kind of went away, but now it's back. And it's like, okay, well, like you said, it's a chronic thing, and anything that you do to trigger it is going to make it come back to some degree, but you just want to keep it as good as you can for as long as you can.
Absolutely. And I think setting that expectation and that knowledge, just a little bit of knowing about it, is super important in the beginning, just so as a patient how your journey is going to look, over the years, because it's not just this one-time thing.
Do you have a favorite like daily pigment control cream that you like for your melasma patients?
Yeah, so a lot of them I actually do prescription compounding. So I do love the hydroquinone. There's a way to use it. I don't think, I always educate that not every day you should use it, but I do 3 months on and 3 months off in my protocol. So it's really great. It's prescription strength. I think it's more effective. I like to combine it with fulvic acid and keep it just super gentle because those two work well together. And then some other ingredients. So elastin has a great illuminate product. Skin Medica has a great even and correct system with serums and lightning pads. And so I think the combination honestly is great with prescription and definitely sun protection. With melasma, I think it's not even an option to be on a chemical blocker. They need to be on a physical blocker. And then tinted sunscreen, like you had mentioned, like the blue light has been shown to protect against that. So tinted sunscreen for my melasma patients is always the recommendation as well. They actually get a little bit more coverage and protection from that. So that's huge.
Gotcha. Okay. And we skipped a question. I forgot. Somebody asked, should you be getting some sun exposure without sunscreen? Like, is that bad? Is that good? What are your thoughts on that?
I always say sun protection is key. So,
I knew you would. Meanwhile, I'm like, you need to go out and sunbathe and you need to be grounding. No, I don't necessarily say that, but I do think it's true.
There's no such thing as a safe tan, because I have friends and patients that are like, I just want like a base tan before I go on and whatever. There's no such thing as a safe tan. And whether it's for medical or cosmetic reasons, we know that just a few minutes in the sun actually creates DNA changes and is starting the aging process. And so we don't, as dermatologists and myself, I don't recommend any type of sun without sun safety. Not that you can't be out in the sun, just protect yourself. And then I always commonly get asked the question about like, oh, vitamin D deficiency. You're still getting enough with your sun protection, and the likelihood of someone covering head to toe with no exposure to sun is pretty rare.
Right.
And it's one of those things that, sun
and
safety.
I feel like, and I feel like so many people take an oral vitamin D supplement anyways, which if you're taking it, you should be taking one that's absorbed well. So,
Exactly. Yeah.
You
Just
can find your ways.
I get that question with sun exposure as well quite often.
So, I'm sure, because you've got like very natural people in California and they want to be in nature.
Exactly. But no, so the answer, always be sun safe in the sun.
Okay. That is her answer. So now let's go to rosacea. I do not see a lot of people with this. I'm sure you do in your line of work. So, but it is common, the redness. What are your favorite treatment options for this? Or maybe tell our listeners like kind of what rosacea exactly is versus just like redness.
Sure, absolutely. So, rosacea I consider its own skin type and very similar to melasma, which we just talked about. There are definitely triggers that make it worse. And just like melasma, unfortunately, it's considered chronic. So when you have rosacea, you have it forever. Now, rosacea, unlike, melasma for a lot of the time is the medical treatment covered by insurance. So it's one of those things that can progress over time, and insurances allow us to treat this medically. On the medical side, we have a lot of topicals and oral medication to reduce the redness, the flushing. One of the theories of the causes of rosacea are demodex mites that live on us. So people that have a higher number of these mites are considered to be more rosacea prone. It's one of the theories. They don't really know what causes rosacea. They know it's like genetic. They theorize that the mites have something to do with it. And like the perfect storm of variables can trigger it for people. And once it's triggered or once it's present, you always have it, and it could fluctuate, but we use some of those treatments to minimize any of those factors. So more anti-inflammatories. Go ahead. What were we
So do
gonna
we all have these mites, but they just have more mites?
So the theory is like more and more active. I know. We can actually like scrape them, it doesn't hurt, and like look under a microscope, and we'll take a look and see like how many we see, or if they're like prevalent in the scraping at all. Yeah, it's kind of.
I feel like I knew this at some point in my life, but forgot about it. And you just refreshed my memory. And now I'm a little bit grossed out, but it's fine because we all have it.
It's part of our normal flora. Like there's so many things that live on all of us. So we do have to be careful what we put on, because outside of rosacea, just that fact, and I hear this all the time, especially in LA, like people love the natural plant-based things, but a lot of those products can actually feed your normal flora and give you issues. And so
I was going to say, you're feeding the mites.
exactly. And the bacteria and the yeast, and things are just like going wild. So don't do all the like things can be, vitamin A is natural, and that's your retinol, but like the whole like clean plant-based, great for like consumption of food, not great for topicals on your skin. Just caution as your PSA for today. But going back to rosacea, there's medicine, so there's creams and orals. But on the other end, and a lot of my rosacea patients, especially after summer, since it's triggered by heat and sun as well, will come in, and I love to do light therapy, like a photofacial, either IPL or BBL for those patients as well, and really zap away some of those blood vessels and get the redness to decrease just with light.
Amazing. Okay. And someone asked about ocular rosacea. Do you see a lot of that?
I do. So it's a screening question with anyone with rosacea, and not a lot of people actually know about ocular rosacea that happens.
Never heard of it. Never heard of it.
So there are 4 main types of rosacea, like 3 with the skin and 1 with the eye. So ocular rosacea is a subtype of rosacea in the eye. So anyone that gets flushing in the skin, I always pre-screen and ask about their eyes. The comments we usually hear are like eye dryness or like a gritty feeling in your eye. That might mean you have ocular rosacea. And we usually see this alongside, sorry, let me just send that to the front. But usually we see that with patients that have the skin. So a lot of times they're there together. But if you have that, definitely talk to your doctor. We usually go the oral treatment route. And then there's some eye drops we can also give prescription wise for that as well.
Gotcha. So there is a way to make it better, which is really beneficial.
Yeah,
I have a freckle on my retina. That always freaks me out. It freaks me out because I'm like, wait, can this progress to something that's atypical and something like a melanoma? Do you know about that?
So we have melanocytes in many areas, not just our skin, the retina being one of them. I also have a little spot in mine. So I get mine checked, and I think it's super important. So as dermatologists, we recommend skin checks once a year, just to make sure the moles you have are healthy, and just to take a look, because some spots that don't, we might not consider a mole as a person. Once your dermatologist sees it, there's different variations of different moles. But we also recommend an eye screening every year as well, because you can, as well as, a normal pap smear, because you can get melanocytes within the lining, the vaginal walls as well. So just being proactive is the best thing. Getting screened once a year is super important.
100%. I totally agree. I get my eyes checked once a year, and they always look at that. And I remind them, like, I have a freckle, check for the freckle.
Same. I have one too, which is crazy. In residency, we would always like take our little lights and all my residents would look and we would take pictures in my chart. I need my
So
fellow
funny.
residents to keep checking. But I do. I go see an eye doctor once a year as well.
Yeah. Okay. So I want you to tell us about your new practice. Like you just announced. So this is kind of like perfect timing. I'm so excited for you. Tell us what's happening and what you're doing now.
Yeah, so I've been practicing for 3 years now since residency in LA, and I have now opened my own private practice, which I'm so excited about. It's called Divina Dermatology and Cosmetic Center. It's located in the heart of Beverly Hills, and it is my baby. It is like, and I'm sure you know this, opening your own practice and running it is just a different world, but it's the most fulfilling, and I'm so glad I did it. And we're doing medical, cosmetic, and surgical dermatology here, taking insurance for our medical patients. We are offering all the newest state-of-the-art technology in the cosmetic world with lasers and treatments and injectables. We have a surgery suite in here as well. We do Mohs surgery, which is the removal of skin cancers and reconstruction, as well as some cosmetic treatments and surgery as well. So I'm so excited to now offer a full service for all my patients.
That is so exciting. So if you are in the California, Beverly Hills, LA area, please go see her. She is one of the best.
Thank you. No, it's amazing, and I absolutely love it. I can't wait for you to see it. You have to come fly out here and visit LA soon.
I know. I haven't been there since before the pandemic. Everything went
think that was
crazy and then I just haven't gone over there.
I think that's the last time we saw each other. It was 2019,
Mhm.
2020 or 2019. It was right
Yeah, yeah.
before COVID. I think it was maybe 2020, and then the world closed.
Yeah, like pretty soon afterwards.
Yeah,
Like I remember it was that Think Big and we were then like signing up for the next year and I was like, I don't know yet. And then like it never happened again because
yeah. I think that, yeah, exactly right. It was in January as well. And that was like one of the last outings pre-COVID that I had. So very
I
crazy.
know, I know. Well, are things mostly back to normal where you are? I mean, Florida, we're the Wild West and things never really went different.
I know. I started during the start of the pandemic, I was still living in Miami, and then I moved back to LA 2020, like in the summer. So such drastic differences for sure. But LA is back to normal. Things are running. And as a medical provider like yourself, even in LA, nothing ever stops. So like really
Right.
there's no true break for I don't think either of us, but the world around us was kind of slow.
Yeah, exactly. Okay. Well, I thank you so much for all of this amazing information that you gave today. I feel like this was like dermatology 101.
It's great. And the questions were amazing. They're very common, frequently asked in clinic all the time. So I think it's really good to just be educated about these things.
100%. So, where can people find you? Like, do you want them to find you on Instagram? Where do you want them to find you?
So my Instagram handle is JH Dermatology. It's just my initials. And then you can look me up online if you want to book an appointment or reach our office. You can just Google my name and our office should come up, Divina Dermatology and Cosmetic Center, for all your needs.
Okay, so make sure you guys follow her. Again, it's at JH Dermatology. Send her a DM, give her a call if you're ever in the area. She's doing a lot of big things, and I'm so excited for her. I'm excited for Divina Dermatology. But I also am excited for this podcast. So I want everyone to go and leave a 5-star review, rate the podcast, make sure you are subscribed, and send me DMs with any additional questions or topics you want to hear about in the future. Thank you, everybody. And thank you so much, Jackie, Dr. Hakim, for coming on today.
Absolutely. It was a pleasure. It was so good to catch up with you.
You too. Bye, doll.
Bye.
Oh, hold on. Don't get off yet.
Okay.
Let's take a selfie. I'm
Love
going
it.
to take a
I'm
picture.
glad you caught me.
Okay. 1, 2, 3. Okay. I think that, let me check.
Tag me.
Yeah,
Shout
perfect.
out
Okay.
that like anyone that reaches out, like in the next month, I'll honor a 20% discount too for you.
Okay, great. Yeah, I'll
If
make
you
sure I
are in
put
the
that
area.
in the Yeah, I'll put that in the podcast notes. And then like when we post it later, this will probably come out in about 6 weeks.
Okay.
Because that's like my follow-up time. But when we do that, we'll put that on there.
Perfect. Sounds good.
Amazing. Thank you so much, all. Have a great rest of your day.
You too. Take care. Bye.
Bye.